Hi, I'm Dr. Dennis Furking, and I'm here with Dr. Nick Gatto, representing the Food Enzyme Institute. In Seminar 4, you're going to learn clinical judgment in structural evaluations, the prerequisite of which is completion of Seminar 3. The focus of this seminar is additional hands-on training of the physical problems that result from nutritional deficiencies, and specifically loss of joint range of motion. Additional topics that will be covered include chronic stress, structural misalignments, and visceral dysfunction. After attending this seminar, you'll be able to find the answer to those seemingly impossible cases where pain in the body's bones and joints have a hidden visceral cause and require seemingly unrelated nutritional modification for correction. Completion of Seminar 4, Clinical Judgment in Structural Evaluation, also makes you eligible to be listed on the free practitioner locator online, where patients look daily for advanced food enzyme trained practitioners in their area. Nick, could you tell them what they would expect to learn in this?
Yes, this course, I don't want to de-emphasize the other courses, but to me this course is the Super Bowl. This is, this is the pinnacle, really bringing the whole system together. We're going to have an in-depth look at the complete physical examination and defending deviations from normal. So for instance, if a patient has a arch issue in their foot, on their one foot, creating some type of structural stress, the body needs more nutrients just to stay upright against gravity. So that's the real cause of the problem, right? But if that goes on for too long, could cause some visceral issues. So that's what this seminar really, as an overview, really is going to bring to them, the ability to recognize that and correct the real cause. We go through the sitting and standing examinations and the relentless progression of universal stress and energy deficiency. That is a thing I think that is overlooked in most healthcare practitioners' offices. Because again, we've all been trained in that pathological pharmacological model that you give this for that symptom, and we're not treating symptoms here, we're looking for the cause. But that chronic stress, and you can read it like a roadmap, and you mentioned the 24-hour urinalysis, that's part of that. You can see this happen as the body goes through different phases of stress as you lose your health. Food enzyme deficiency syndromes. We look at an in-depth look at the rationale and diagnosis to identify energy deficiency. So again, that's part of that, finding the cause. And then, and I don't think this is taught anywhere else, the body's two pump systems for moving energy. Yep. Right? You've got the breathing pump, right, which is a big part of it, and the walking pump, and how the body moves nutrients through the connective tissue to the cells to nourish them, and more importantly, and this is something that I don't think is taught anywhere else, is removal of the waste products. And that's where the lymphatic system comes in. So we look in depth at removing lymphatic congestion and stasis and trying to restore normal function there. And then we look at chronic metabolic syndromes and the four typical symptom patterns that comes with. Chronic metabolic syndrome is as the body stresses, through carbohydrate and protein deficiencies, and in lipid deficiencies, it's kind of the last stop before you might end up being diagnosed with a disease process. So that's part of a big part of that seminar. This system can apply to any healthcare setting, or if you're just interested in learning the material to take care of yourself and your own family.
If there was two things that food enzymes do really, really well, what would you say those two things would be?
Well, they will pre-digest your food.
If you pre-digested your food, would you not eliminate a lot of toxins?
Yes, you're gonna take the stress off some major organ systems.
I work in my daughter's office 3 days a week, but there was a general manager of a very large resort in Branson where I live that they wanted a chiropractor to come in and work on their employees 1 day a week. And so he asked me if I would be willing to do that. In my retirement, I need something fun to do, so I said yes, I would do that. And they are absolutely amazed as we've never had this type of examination. And you know what exam I do?
Yes.
The one I learned
here
from Dr.
Absolutely.
Loomis.
Yeah.
Yes. I'm looking for, as you mentioned, a deviation from normal.
Yeah. Yes.
And when I stand them up, I check their posture. Then I'll do the exam, the seated exam that they'll learn. I would check the stress points. And they said, what's that all about? I didn't know that was tender. Right. Yeah. Well, how do they get a hold of us, Nick?
All right, if you're looking to get a hold of us after watching this video, you can always contact us on our website at www.foodenzymeinstitute.com, or you can please call our customer service team at 800-662-2630 and mention that you saw this video.